Assalamu alaikum everyone. It's Dr. Rida Khan from Medico's Guide, and today in this video we will discuss about adult basic life support. Here we are going to evaluate a collapsed victim effectively. We are going to discuss about how to perform the chest compressions and rescue breathings appropriately, and how to place an unconscious breathing victim in a recovery position with precision. Now, before getting into the video, we should know what is the background. So, approximately 7 lakh, or you can say 700,000 cardiac arrests occur annually in Europe. Presently, survival to hospital discharge is around 5 to 10%. Bystander CPR is a crucial intervention before emergency service arrives, and therefore it doubles and triples the survival from the sudden cardiac arrest. Early resuscitation, prompt defibrillation within 1 to 2 minutes can yield a survival rate exceeding 60%. And that's what is the purpose of doing the basic life support. So now let's see what is the introduction of the basic life support. So basic life support, or the BLS, refers to a set of essential emergency procedures that are designed to sustain life in individuals who are experiencing cardiac arrest, respiratory failure, or other life-threatening conditions. So, BLS techniques include recognizing, responding to emergency situations, calling for help, performing CPR, that is cardiopulmonary resuscitation, using automated external defibrillators, that is AEDs, and providing basic airway management and breathing assistance. Now, BLS is typically provided by the trained medical professionals or the bystanders until the advanced medical care can be obtained. Now let's talk about what is the importance of knowing the BLS. So performing CPR and using an AED, they are essential procedures to help sustain someone's life until professional medical help arrives. So BLS skills can mean the difference between life and death in critical situations. And having this knowledge can give you the confidence to take action and potentially save a life. Now, what are some events that may require BLS? First of all, we have cardiac arrest, and this is the most common reason for the need of BLS. It is the sudden loss of heart function and can occur due to a variety of reasons, such as heart attack, drowning, electric shock, or more. Choking, so when a person's airway is obstructed by food, object, or other materials, it can cause them to choke and their breathing may stop. So, BLS can be used to remove the obstruction and restart their breathing. Then suffocation. So suffocation can occur from smoke inhalation, gas leaks, or being trapped in small spaces. So BLS can help restart their breathing and sustain their life until professional medical help arrives. Then drowning. So when someone is submerged in water, they may not be able to breathe and their heart may stop beating. So BLS can be used to help restart their breathing and revive them. Severe allergic reactions. So, anaphylaxis is a severe allergic reaction that can cause a person's airway to become blocked and their heart to stop beating. BLS can be used to help them open their airway and sustain their life until the professional medical help arrives. Then, drug overdose. When someone takes too much medication or drugs, it can cause them to stop breathing and their heart may stop beating. So, BLS can help these individuals. Then trauma. So when someone experiences a severe injury or trauma, it can cause them to stop breathing or their heart to stop beating. And similarly, the BLS is helpful for these individuals too. Now in chain of support, there are four important components. Early access to prevent the cardiac arrest, early CPR to buy time, early defibrillation to restart the heart, and early advanced care to restore quality of life. Now here are the steps of the basic life support. First one is approach safely, then we have check response, shout for help, open airway, check breathing, call 1122, attach AED, follow voice prompts. So now let's discuss them one by one. Okay so our first step is approach safely. So basically, we have to assess scene safety before performing CPR. It is essential to evaluate the area for potential dangers like debris or hazardous materials before initiating CPR. Ensuring scene safety before starting CPR will prevent injuries to you, to the patient, and any bystanders. Now, the second step is check response. So you have to shake shoulders gently and ask, "Are you alright?" If he responds, leave as you find him. But if there is some doubt, so you have to find out what is wrong and reassess regularly. Then you are going to shout for help if you find any sign of danger. Now open airways. So you can open airways by neck extension, and this would let the air to go in and out easily. For opening airways, there are two procedures. The first, that is performed in anyone who hasn't sustained any cervical injury, so that is going to be head tilt and chin lift. And it is very easy, it can be performed any lay rescuers or non healthcare rescuers. And now there is no need for finger sweep unless you find any solid material that can be seen in the airway obstructing the airway. And the other one is head tilt, chin lift plus jaw thrust. And this type of procedure is performed in those who have sustained cervical spine injury. And this procedure is only performed by the healthcare professionals. Now let's talk about check breathing step. So here we have to apply look, listen and feel for the normal breathing. Do not confuse agonal breathing with a normal breathing. Now what is agonal breathing? So agonal breathing occurs shortly after the heart stops in up to 40% of the cardiac arrest. It is described as barely, heavy, noisy or gasping breathing. And if you find this agonal breathing, so you have to recognize it as a sign of cardiac arrest. And any erroneous information can result in withholding CPR from the cardiac arrest victim. Now, the 5 H's and the 5 T's is a mnemonic used to help in the recall of major and reversible contributing factors to pulseless arrest. The 5 H's are hypoxia, hypovolemia, hypothermia, hyperhypokalemia, and metabolic disorders, hydrogen positive ions, that is acidosis. And now in the 5 T's, we have tension pneumothorax, tamponade, toxic therapy, disturbances, thrombosis coronary, thrombosis pulmonary. Now the next step is call rescue 1122. So call for professional help, that is EMS. It is crucial to activate the EMS, that is emergency medical services system, as soon as possible to ensure that professional help arrives on the scene. You can call the emergency number in your area and follow the instructions provided by the dispatcher. Foreign body airway obstruction, that is FBAO. So approximately 16,000 adults and children receive treatment for the FBAO yearly. Now let's see the details. Now when you're gonna ask the patient, are you joking? So in case of mild obstruction, they can just say yes. While in case of severe obstruction, they are unable to breathe or they may just nod their head. While in case of other signs, so in the mild obstruction, they can speak, they can cough, they can breathe. While in case of severe obstruction, they cannot breathe, they may be wheezy breathing, or there may be a silent attempts to cough or unconsciousness. Now let's see what is the treatment of adult FBAO. So first of all, we are going to assess the severity. If there is a mild airway obstruction, it means that if the cough is effective, so we are going to encourage the cough. And we have to continually check for deterioration to ineffective cough or until obstruction is relieved. Then in case of severe airway obstruction, that is in which the person is having ineffective cough, so now first of all, on the basis of the level of consciousness of the patient, we are going to determine what is going to be the treatment. If the patient is conscious, we are going to do 5 back blows or 5 abdominal thrusts, that we are going to discuss them in the subsequent slides. While if the patient is found unconscious, we have to start CPR. Now back blows. So the procedure that we are going to perform on the patient, it depends upon the size of the obstruction. For example, if the small object has obstructed the airway, so we are going to perform the back blows. While if some larger object has obstructed the airway, then we are going to perform the abdominal thrust, which are also known as Hamlish maneuver. Now 30 chest compressions. So first of all, we have to check the patient's airway, breathing, circulation, and after determining that the area is safe, the next step is to assess the patient's airway, breathing, circulation. Check for any signs of breathing or a pulse. If the patient is not breathing or has no pulse, you have to start CPR immediately. Now let's see how to perform CPR. First of all, chest compressions, they are the essential part of CPR and they help circulate blood to the brain and other vital organs. When performing chest compressions, ensure that the patient is lying on their back on a firm surface. Place your hands on the chest and press down about 2 inches at a rate of 100 to 120 compressions per minute. After 30 compressions, give 2 rescue breaths and repeat the cycle. Follow the proper speed and cadence to increase the chances of successful outcome. This is how you can provide the chest compressions. Place the heel of one hand in the center of the chest, place other hand on the top, interlock the fingers, compress the chest at the rate of 100 compressions per minute, and this should press down the chest at about 4 to 5 centimeter. Then you are going to apply equal compressions and equal relaxations, and when possible change CPR operator every 2 minutes. And this is how you are going to apply the rescue breaths. So pinch the nose, take a normal breath, place lips over the mouth, blow until the chest rises, take about 1 minute and allow the chest to fall, and then repeat. Now you can also provide the breathing mouth to nose, and it is done when you can't open the mouth, when you can't make a good seal, if the mouth is severely injured, if there is a stomach distension, and if you have to give the breath from mouth to stoma, that is tracheostomy. You have to continue CPR, and the recommendations are that the tidal volume should be 500 to 600 ml. Respiratory rate, so give each breath over about 1 second with enough volume to make the victim's chest rise. Then the chest compressions only continuously at the rate of 100 minutes. Now defibrillation. Defibrillation is a use of electrical current to help heart return to the normal rhythm when a potentially fatal arrhythmia, that is abnormal heart rhythm, is happening in the heart's ventricle. Now AED, that is automated external defibrillator. So if an AED is available, it should be used as soon as possible. AEDs are user friendly and provide voice prompts and visual cues to guide you through the whole process. Follow the AED's instructions carefully and promptly to ensure the best chance of successful outcome. AEDs are safe to deploy on an unresponsive victim. It is designed to analyze the heart's rhythm and deliver a shock to restore a normal heartbeat. You can have a peace of mind that this device will not shock a victim or a responder. Now the step-by-step guide on using the AED. Turn on the AED and follow the voice or the visual prompts. Remove the clothing or jewelry that may interfere with the AED pads. Attach the AED pad to the person's bare chest as shown in the diagram on the AED. Make sure that no one is touching the person and press the analyze button. If the AED advises a shock, ensure that no one is touching the person and press the shock button. After the shock, perform CPR. If the person is still not breathing, follow the steps of CPR precisely. Now the AED tips and precautions. So always make sure that the person is dry before applying the AED pads. If person has a pacemaker or defibrillator implanted, avoid placing the AED pads directly over the device. And remember to stay calm and focused and follow the instructions on the AED precisely. So this is how you can perform the CPR if the person is still not breathing after shock. Now if the victim starts to breathe normally, you have to place the victim in a recovery position as it is illustrated in the following diagram. You have to continue resuscitation until the qualified help arrives and takes over, the victim starts breathing normally, or if the rescuer becomes exhausted. Now when can I stop CPR? So if the victim revives, if the trained help arrives, if you are too exhausted, if the scene is unsafe, if the physician directed that is, do not resuscitate orders, and if the cardiac arrest of longer than 30 minutes is there. Now, why CPR may fail? So, if there is a delay in starting, or if the person is using improper procedures, for example, he forgot to pinch the nose while he was giving the breaths, no ACLS follow up or delay in defibrillation, and remember that only 15% who receive the CPR live to go home. And if the person is suffering from terminal disease or unmanageable disease like massive heart attack, so these are all the cases in which the CPR may fail. Now, injuries related to CPR. Now, injuries related to CPR. So, while performing CPR, rib fractures can occur, and these rib fractures then they can cause laceration and liver, lung, spleen. They can be injured while performing the CPR. Now let's talk about the complications of CPR. So, vomiting, aspirations, they can occur as a complication of CPR, and placing a victim on the left side after CPR helps maintain a clear airway and reduces the risk of aspiration in case of vomiting. So, this can be a good position to assume. Then wipe vomit from the mouth with fingers wrapped in a cloth. Then reposition and resume CPR. Okay, guys, so that's all from my side. I hope that it's clear to you. And now I'm leaving two questions for you. Name two techniques applied in severe airway obstruction. And what is the numeral combination of chest compression and rescue breaths in adult basic life support? So, comment down below the right answers, and we'll meet in the next video. I promise. So, until then, goodbye.